All right, let's talk bladder scans. What's the real difference between just doing one and doing one great? It's definitely not just about ticking boxes on a checklist. Today, we're going to take that clinical checklist and turn it into a real, confident skill you can count on. And most importantly, a skill that always puts your patient first. So that's the big question, right? How do you really master this essential, non-invasive skill? Because let's be real, a bladder scan is so much more than just a routine procedure. It's an incredibly powerful diagnostic tool. I mean, it gives us this vital piece of information that helps us steer clear of unnecessary and frankly uncomfortable interventions for our patients. So yeah, how do we get really good at it? Let's break it down. Okay, so at its core, it's pretty straightforward, right? We're using a portable ultrasound to measure how much urine is in a patient's bladder. Simple. But just think about what that one little number actually lets us do. It's huge. It helps us spot things like post-op urinary retention, and it's the key to deciding if something more invasive, like catheterization, is actually needed. It's all about getting the right info in the right way. So to make this super easy to remember, we're going to structure this around what I call the 3 Ps. And our first one, and you could argue it's the most important one, is preparation. And look, this is way more than just grabbing the machine and walking into the room. A great scan doesn't start with the tech. It starts way before that, with solid prep. Okay, these first few steps are just non-negotiable. I mean, introducing yourself, confirming who the patient is, that's not just a formality, it's patient safety 101. But it's the explanation that really changes the game. When you clearly explain what you're doing and why, you can literally see the patient's anxiety go down. It makes them feel like they're part of the team, not just something is being done to. And this quote, man, it just hits the nail on the head. Gaining consent is not about ticking a box. It's not about getting a signature on a form. It's a fundamental act of respect. It's how you build that foundation of trust with your patient. And honestly, without that trust, everything else is just harder. And the prep doesn't stop there, of course. Offering a chaperone, that's all about making your patient feel safe and in control. Simply closing the curtain, that's a basic act of respect for their dignity. And hand hygiene, well, that's our absolute promise to keep them safe from infection. They seem like small things, but trust me, these actions have a massive impact on both the patient's experience and your own professionalism. All right, now for the final technical prep. First, we need the patient positioned correctly, lying flat on their back, supine, so we can get a really clear, open shot of the bladder. And second, just a quick check of the scanner itself. Is it clean? Is it working? This little check saves you so much frustration and makes sure you get it right on the first go. Okay, preparation is done. We are good to go. That means we can move on to our second P. Performance. All that groundwork we just did has perfectly set the stage. Now, this is where the hands-on clinical skill really shines. All right, time to get to it. First things first, ultrasound gel. Don't be shy with it. Apply a good amount right on that suprapubic area, just above the pubic bone. Next, find the patient's midline. That's your landmark. Now you can grab the scanner, get a firm grip, and you're ready to go. Okay, pay attention, because this right here, this is probably the single most important part of the whole technique. Seriously. If you get this wrong, your reading is going to be way off. The secret is to angle the scanner probe down, pointing towards the pelvis. And you might be asking, why? Well, it's just basic anatomy. The bladder isn't sitting right there on top, it's tucked behind the pubic bone. So if you aim straight down, you're just going to hit bone and miss the bladder entirely. So remember, always angle down toward the pelvis. So once you get a reading on the screen, don't be afraid to take a second one. In fact, you probably should, especially if the number seems a little weird, like way higher or lower than you expected. Consistency is everything for accuracy. And hey, while you're so focused on the tech, don't forget the person lying there. A quick, "You doing okay?" can make a world of difference for their comfort. And that brings us to our third and final P, post-procedure. Look, the scan itself might be over, but our work is definitely not done. This last phase is all about that professional follow-through. It's about safety, and it's about making sure that number we just got actually turns into action that helps the patient. Think of this as your wrap-up checklist for a professional finish. You've got to clean the probe and machine. That protects the next person. Make sure your patient is comfortable and all covered up again. That's just basic dignity. Wash your hands. That's a given. And then, the big one, documentation. Write down what you found, note if a chaperone was there, and, this is critical, escalate any worrying results right away. A high reading that just sits in the notes is a huge missed opportunity to intervene. And this really drives the point home. Clear documentation and escalation are just as critical as the scan itself. I mean, think about it. A reading of, say, 600 milliliters of retained urine, that's just a number on a screen. It's meaningless until it's documented and you've told the right person who can do something about it. That action is what turns data into actual care. The follow-through is every bit as important as the scan.
All right, so we've gone through the whole process from the initial prep with the patient all the way to that professional follow-through. So now let's just pull it all together into a really concise summary that you can use as a quick mental checklist every single time.
This little table breaks it all down perfectly, giving you that at-a-glance view of the whole workflow. You can see how the prepare column is all about setting yourself up for success. Then perform, that's where your hands-on skills come in. And finally, post-procedure is all about your professional responsibility. If you can just get into the habit of thinking in these 3 simple phases, prepare, perform, post-procedure, you'll build that muscle memory and be doing confident, consistent scans in no time. So, as we wrap this up, I want to leave you with this question to think about. A bladder scan, it really isn't just another task on your to-do list. It's a genuine skill. And when you master it, you can literally prevent unnecessary pain, you can prevent discomfort, and you can directly lead to better outcomes for your patients. It's one of those small procedures that has a truly massive impact. And now you've got the framework to do it perfectly.